Hello, my name is Taya McClure. This is my medication administration competency, and I'm going to start with looking at my MAR. So on my MAR, I see that my patient's name is Brad Pitt. I see that he's 47 and he is allergic to the medication Competency. So Competency, that is something that we're going to have to document. So I would write that in my notes, in my documents, stating that the patient is allergic to this medication. I would also notify the pharmacy just to make sure that they don't give the patient any medication that contains this medicine. This would prevent any serious complications. It will prevent any adverse effects. All of that, it just rule it out just by notifying the pharmacy, and to also make sure that I'm double checking to make sure none of the medications that they send, just in case there's an error with the pharmacy, that none of the medications they send has this medication in it. Alrighty, so the next thing I'm going to do is read off the list of medications that this patient has, and as I do that, I'm going to go ahead and do the dosage calculations. Alright, so the medications are listed in 4 different categories. So they're scheduled, there is PRN, PRN means as needed, unscheduled, and continuous infusions. So scheduled, PRN or as needed, unscheduled, and continuous infusions. Alrighty, so under scheduled, there are 5 medications. Alright, so for the very first medication, it is called Lacey. But we have here furosemide, which I believe is the same as Lacey. So it looks like this. It's a white tablet. Okay. And this is what it says on the back. It says furosemide and it's not getting clear. 40 milligram tablet. Okay. So the patient needs 60 milligrams, and this medicine is given by mouth, and it's every morning. So what I'm going to do is the dosage calculation. So we need 60 milligrams for this patient. The tablet is 40 milligrams times 1 tablet. It's going to equal 1.5. So that is what I have written here. So here it says 60 over 40 milligrams times 1 tablet is 1.5. So this just means that when we administer this medication, we're going to give the patient a whole tablet of furosemide as well as half of a tablet to give them 1.5. Alrighty. The next medication under scheduled is potassium. Alright, and that looks like potassium. That's going to look like this. So it's blue. Alright. And this is what it says on the back. So it says potassium, and it's an 8 milliequivalent tablet. So the patient needs 16 milliequivalents. It's given by mouth, and it's every morning. So knowing that we need 16 milliequivalents and this tablet is only 8 milliequivalents, we're going to have to do dosage calculations. So what we're going to see there is that we're going to do 16 milliequivalents divided by 8 milliequivalents times, slow down, alright, times 1 tablet equals 2. Okay, that's what I've written here. So 16 divided by 8 times 1 tablet equals 2. So when we administer potassium to our patient, we're going to give him 2 tablets because each tablet is only 8 milliequivalents. Alright, the next medication under scheduled is amoxicillin. Amoxicillin looks like so. It's a red and white capsule. There we go. It is 250 milligrams. And the patient dosage is 250 milligrams. So there's no math calculations needed for this one. It's given by mouth as well. So when we administer this medication to this patient, we're just going to give him 1 capsule of amoxicillin. All right. The next medication is dilatazine. Okay. So dilatazine looks like this. And this is what it says on the back. So the dilatazine, and it's 180 milligrams. So on the MAR, it says that we need a dilatazine tablet, and this is a capsule, of course. So what we're going to need is to call the pharmacy and ask for a tablet instead of a capsule. Okay, so as I said before, it's a 180 milligram tablet, but the patient only needs 90 milligrams. This is also given by mouth. So we're going to have to do some dosage calculations. So what we would do is 100, so we need 90, so it'll be 90 divided by 180, and these are both milligrams, times 1 tablet, because that's what it's supposed to be, a tablet, and that's going to equal 0.5. So that's also another reason why we would need a tablet instead of a capsule, because you can't split a capsule in half. A tablet you can. Right? So here's my work. So that's the 90 over the 180 milligrams times 1 tablet, 0.5. So in administering this to a patient, we'll have to again call the pharmacy, ask for a tablet, make sure that we're giving it to him by mouth, and that we're giving him half of a pill. Well, half of a tablet, sorry. The last medication under scheduled is Prilosec. Prilosec looks like this, right? And this is what it looks like on the back. Okay, 20 milligram capsule. So this is another thing similar to dilatazine. So they asked for a tablet and we got a capsule. So we just have to make sure those little things are that we notify the pharmacy about. So I also have to call the pharmacy and say, hey, I need a tablet instead of a capsule. The difference with this is though that the Prilosec is 20 milligram. This is a 20 milligram tablet, and the dosage is 20 milligram tablet. So it's not like the dilatazine where we had to split the tablet in half. All right, and this is also given by mouth. So when we administer this to the patient, we'll be giving it to him by mouth, and we will give him 1 tablet of Prilosec, 20 milligrams. All right. The next category is unscheduled. The only unscheduled medication that this patient has is influenza vaccine, and so it's just the flu vaccine. Because it's unscheduled, it's saying that like this is not something that he's getting every day or like every week or something like that. It's just like whenever you get around to it or can get to it, right? So this patient will most likely get it before discharge. And the next category is PRN, or as needed. And the medication under this is morphine sulfate, just pain medication. All right, so morphine, and it's 10 milligrams per milliliter. So once again, morphine, make sure my camera gets it. Morphine, 10 milligrams per milliliter. All right, so the dose that's needed for this patient is 2 milligrams. And as it showed on the vial, that it's 10 milligrams per milliliter. So I'm going to have to do more dosage calculations. All right. So we need 2 milligrams. The medicine is 10 milligrams per milliliter. So 2 divided by 10 is 0.2. And that's going to be milliliters. Because when you divide the milligrams, you're doing 2. You need 2 milligrams. So you're finding that 1 milligram is 1 milliliter. So it'll be is 0.1 milliliter. So once again, 1 milligram would be 0.1 milliliters. So if you're going to do 2 milligrams, it's going to be 0.2 milliliters, as shown here. So I did the 2 divided by 10 milligrams, both milligrams, and then it's the 10 milligrams is per milliliter. So the answer is going to be 0.2 milliliters. All right. And this medication is different. It's not given oral. It will be given intramuscular, which means in the muscle. So it is also given every 4 hours, and this is as needed. So this medication, when it's administered, will be given in one of the intramuscular sites, and it will be given by a 2 milligram dosage. Right. And the last category is continuous feeds, and there are no medications under continuous feeds. Okay. Next question that we have is what medications are due for 9 a.m. So the medications that are listed for 9 a.m. would be under scheduled. The medications listed for 9 a.m. under scheduled is the Lacey tablet as well as the Prilosec tablet. So what we will make sure is that we are going by the right. So we would do the right, make sure it's the right patient. So make sure that it's Brad Pitt. We're going to make sure that we're doing the right medicine. So the Lacey and the Prilosec at 9 a.m. We're going to make sure that it's the right dose. The right dose would be for the Lacey 60 milligrams. The right dose for the Prilosec would be 20 milligrams. We're going to make sure that it's the right route. The right route for Lacey is by mouth, as well as Prilosec, it's by mouth. And we're going to make sure that it's the right time. So both of them are given at 9 a.m. And also, after we finish administering the medications, we're going to make sure that we document it. So the right documentation. Okay. So it says walk through obtaining oral medications for 9 a.m. All right, and I already stated each right, and I showed the medication math. But when we do give oral medications, we give them in this cup. So we open the package. So see, this is the Lacey. So we would open this and we would place it in here. But when we get into the patient's room, we want to state the medication again to the patient, make sure that we're checking his identification, we're going through the rights again, and we're placing the medications in here. We're going to go by what the patient needs. So if they can only take 1 tablet at a time, maybe we just need to put 1 tablet in at a time, because they're getting Lacey and Prilosec. And we have to make sure that we're staying in the room with the patient until medications are gone. We cannot step out of the room while the medication is still in there, because then we don't know if the patient took the medication or not. And therefore, we can't be certain that the next time to give the medication will be the right time. What if the patient forgot to take it and took it like 5 minutes before we walk back in the room to get the next round of dosage of medications? So that's something we have to be careful of. Alrighty. So the next thing is to walk through administering insulin. So this patient does not have any list for insulin on the MAR, but we have to know how to give insulin. Okay, so insulin, what we check before. So the biggest thing to check before is the patient's blood sugar. So say we had to get this medication at 7 a.m. We're going to check the patient's check the patient's blood glucose before then, because we want to make sure that when we give this medication, the insulin, we want to make sure that we're not dropping the blood glucose level lower than it needs to be. All right. So that's one thing that we'll be checking before. We also want to check that the vial of insulin is not expired. We want to make sure that we pick the right syringe and needle. Okay, so what we have here is a syringe for insulin. So it looks like this, and it is a 31 gauge, I believe, and it says insulin on it. Okay, and the difference with this syringe is that it's in units and it's not milliliters. So when we give this medication, we have to remember that we're not given by milliliter, we're giving it by units. Okay, so like if we're supposed to schedule 6 units, we know that there is a 10 right there, and we're going to go up further than that. We're just going to make sure that we get to the 6. Okay. What is important to remember when administering insulin? We have to remember double verification. So double verification means that I calculate my dosage for insulin for my patient Brad Pitt, and when I do that, I say, okay, this is what I got. I go get another registered nurse to come and look at those calculations. So what they would do is on the side, write up the calculations and make sure that it looks exactly the same as mine. So the calculation is the exact same. They'd verify most likely by signing off or just like notifying that it was a double verification. We have to remember that. And insulin is given subcutaneously, which just means beneath the skin. There are different areas to give insulin. You can give it in the abdominal, but when you give it, it has to be 2 inches away from the navel. You can give it in the outer aspect of the arm. You can give it on the upper scapula. You can give it in the thighs, well, the front of the thighs, and just things like that. When you also give it, you have to make sure that you pinch the area. So if you're giving it here, you have to pinch and then stick where you're pinching. You can give it at a I believe it's a 90-degree angle, and you can also give it you can also give it at a 45-degree angle. So 90-degree angle or 45-degree angle. But either way, you have to make sure that you pinch the skin. All right. The next section says that my patient calls out stating that they are in a great deal of pain. What must I ask the patient before administering pain medications? Okay, so before administering pain medications, you would want to know what's the location. So like, where are they hurting at? You would want to know how bad are they hurting? Is it something that they could tolerate without medication? Is it something that, you would give a little dosage of medication for, or something for a lot? So like you would ask, like, what is the medication level on a scale from say 0 to 10? All right, with 10 being the worst pain ever and 0 being no pain at all. I would also ask, like, is the pain dull, sharp? Is it just achy? Things like that. All right. It says, observe your MAR and determine your patient. You observe your MAR and determine your patient can have morphine. IM is intramuscular. As I stated before, this medication is giving intramuscular, and most likely will be giving it through the deltoid muscle. So as I said, it will most likely be given through the deltoid muscle. Okay, so this is a morphine injection. Okay, and so I already completed my medication math. So as I said, it's morphine, this vial right here. So it's morphine, 10 milligrams per milliliter, and I did my calculations, which states that we need a 2 milligram dosage, but the vial is 10 milligrams per milliliter, so we need 0.2 milliliters of morphine to be administered to the patient. All right, so it says, walk me through which needle size you would choose and what location you would administer this medication. So like I said before, it will be given through the deltoid muscle. The size that I would choose is, what is that needle? Okay, so because we're given a 0.2, a very low volume, I would choose this needle. So it's a 1 milliliter, 25 gauge, 5/8 inch needle. Okay. All right. And so to administer this medication, I will show you how. So this is the vial. All right. So we would take the cap off. All right. And when we take that off, the top looks like this. Before we take anything out with the needle, we're going to wipe it off with an alcohol pad. So use an alcohol pad and wipe this off really good. Okay? When we do that, you have to make sure, so here's my needle. All right, and so what we're going to do is we're going to first aspirate. So we're going to pull the plunger down to 0.2 because that's the dosage that we have to give. All right, and so I think you can see that there. So that's 0.1 above, and I'm at 0.2. Right? And so what I'm going to do is, so I am going to uncap the needle as so. Okay, pull this back, and I'm going to stick it in here, and I'm going to push the air out. Then I'm going to invert and pull out just what I need, which is the 0.2, and slowly coming in. It seems like it's maybe a thicker fluid. All right, so all right, 0.2 is what I need. All right. I'm going to take my needle out. All right. And then I would administer it. So when you're administering this, you would administer it on the deltoid muscle, like I said. And so you will find the acromonian process, and you would go 2 to 3 breaths below it, and then you would find you would draw an invisible line down the axial, and you would find, so when you do the 2 to 3 breaths below the acromonian process, you're fine, that's the base of the triangle. So you're going to like create this in a triangle scenario. So that would be the base, and the axial would be when you're going along the axial, the visible line, that's the tip, and you're going to stick in the middle, so the center of that triangle that you like imaginarily create, and you're giving it at a 90-degree angle, dart like. So here would be a patient, stick it in, and I would plunge it, and that's 2 milliliters. All right, and that is squirting everywhere. But that is how I would administer that. Now I'll put the safety on, and this would go into the sharps container. All right, and when we give that medication, when we do intramuscular, we can also have to remember that we sometimes have to do the Z-track method on patients. And so when we do the Z-track method, it's literally just like, say if this is not a muscle, but you would pull, so you would push down and pull away from the site where you're going to administer or put the needle. Okay, so what that does is it prevents bruising. So you just push down, pull away. So you're just like stretching the skin slightly to prevent bruising. All right. Alrighty. So it says next we will administer medications via NG tube. When administering medications, what does the head of the bed need to be? So when with an NG tube patient, the head of the bed would be semi-Fowler, so like 30-45 degree angle. This patient doesn't have an NG tube, but if we were given medication through it, what we would do is, so what must be checked prior to administering medication. So you have to check the placement of the NG tube. So the NG tube, like if the NG tube is in the trachea, if you're delivering medications, it's not getting to where it needs to be. So there's different ways of checking the placement. So like an X-ray or things like that. That's honestly the most accurate way of testing, but the way that I would do it will most likely check the mark. So when we mark the tube after we place it in, so from the earlobe to the nose to the xiphoid process. So when we measure that, we put a mark where the tube would be. So in that, the mark will be on the nair where it's taped down. So I would make sure that the tube is there. I would also aspirate some GI fluid, and I would test with the pH strip just to see the acidity of that fluid, just to make sure that it is in the stomach and not in the trachea. All right. So just make sure that it is in the stomach. All right. And it also says what types of medications can't be crushed. So those are your extended release medications. So you can't crush any extended release medications, tablets. You can't crush a capsule, but no, not crushing any tablets that are extended release or have like a EX, ER, EL, or anything like that. We don't crush those. Okay, so it says walk me through how you would give medications via NG tube. So an NG tube medication, so like we were talking about what not to crush, but the medications that you do crush, you would crush the medication and put it in sterile water. And so by doing that, you're diluting the medication so that you're able, because like you can't put a pill through a tube, so you would need to put it and make it into a fluid. So that's how you would do that. You would put it in sterile water. And so when you administer the medications, I mean, I don't have it here, but you could, what you do first is you make sure that you flush it just to get any medications that were previously put in there like out, so it's not mixing, like you don't have an adverse effect or anything like that, or a contraindication. All right. And so what you also do, one second. Sorry about that. What you would also do with the NG tube, you would flush it, like I said, first, and then what you would do is you would administer the medication. Well, you flush it, you use 30 milliliters of water, and then you would administer the medication, and then you would flush it again. All right, and you would leave the patient at the semi-phallus position, make sure that the medicine is flowing through, and then that's just how it would go. And I believe I have addressed everything that I need to. All right, just making sure that we are following the rights, as I said, so the right patient. So we're making sure that it is Brad Pitt. We want to identify our patient when we walk into that room. So we want to ask them their date of birth, ask them their name, things like that. All right, we want to make sure that it is the right medication. So we would check on our mark 3 times to make sure that we are administering that medication correctly. All right, we will make sure that it is the right route. So are you giving it by mouth? You're giving it intramuscularly, like an injection? How are you giving it? All right, so I said right patient, right medicine, right route. You want to make sure it's the right dose, so make sure you're doing your doses calculations, make sure it's the right time, and as soon as you finish administering, you walk out that room, you need to document that you gave that medication. If you don't document it, you didn't do it. All right, and I believe that's just about everything, and it's really important that you do the right doses calculations with insulin. Just make sure it's double verification, everything like that. All right, I believe that's it.